So I spoke on non-motor fluctuations, which is an important concept that accompanies perhaps most fluctuations. When people talk about fluctuations, they usually refer to motor fluctuations, but my talk was on non-motor aspect of it, which for some patients is more troublesome than motor fluctuations. So the non-motor fluctuations usually comprise of three components. Some patients feel their thought process is slowed up, they might have difficulty with their memory, etc. That's called the cognitive non-motor fluctuation. Some people have very marked sweating, problems with blood pressure control, flushing. That's the autonomic non-motor fluctuation. And some people have severe pain or dysesthesia during fluctuations, and that's the sensory non-motor fluctuation. And some people might have combination of it. So I spoke on the importance of these non-motor fluctuations in people with Parkinson's. The fact that some people are so worried about it, they can turn themselves off, a phenomenon known as metacognitions, and also the fact that this is very, very common, contrary to some old data, which suggested that non-motor fluctuations can occur in about 17 or 18% of people with Parkinson's who are treated with levodopa. We now know it can be up to 60 to 80%. So it's a very high proportion, and recognition is absolutely crucial because, as I showed in videos, that there are patients for whom anxiety, pain, sleep disturbances, as well as problems with memory and thought process might be more important than tremor and the stiffness that they may feel during off. So it's a combination of the spectrum that forms the whole syndrome of non-motor fluctuation. And now you can also measure and quantify it. The newly released MDS-NMS scale has a separate non-motor fluctuation domain. So you can just fill that. It's got only 8 questions, quite easy to complete. There is also a more detailed scale called NMSS, which has more than about 30 questions, which is much more time-consuming. That's more a research tool, but the MDS-NMS non-motor fluctuation subscale has now been validated for non-motor fluctuation and is an easy way to address this in clinic.